Well, good morning, everyone, and welcome to the North Fulton Improvement Network Fireside Chat. This is Fireside Chat number 5, I believe, um, which I was just mentioning. I'm amazed that we have been able to accomplish so much in such a short time. I'm Jack Murphy. I am the chair of the Improvement Network, and I am just going to introduce us and then turn it over to the folks that really know what's going on. Um, this is dealing with food insecurity, and you're going to, if that term is new to you, you're going to hear a lot more about it today. A couple of housekeeping uh, things. One is this meeting is being recorded. We do that so that we will have a record of it. We keep it on our website, and we also put it on Facebook. I'm sorry, on I think it's on I think it's on YouTube. I can't remember where we put it, but our website has the links to all of the areas. Please do join us on social media so that we can get a little more hits. If you'll keep your phone on mute, if not, I will put you in the penalty box myself and mute you. But we will be monitoring questions that come through on the chat, and we'll get those through to people as soon as we can. This a little bit about the Improvement Network. Well, sorry. A little bit about the speakers today. Jon West is joining us from the Community Food Bank, and Laurie will introduce Jon, as well as Doris and Mel from the CAC and the NFCC. Those are very capable, very experts. They are really experts in this field. So let me talk for a minute about the Improvement Network. We're a group that's been around for about 5 years. In the last 2 years, we've decided to morph into a think tank kind of organization. We don't provide direct service, but we're comprised of probably right now there's almost 400 people on our email list. About 30 to 40 are folks that work with our work groups each month. We have 5 work groups. We have affordable housing, income, transportation, and child well-being, and this one that's dealing with food insecurity. The goal of the Improvement Network is to help people, all people in Fulton County, get on more stable financial footing. And we think food insecurity is a big part of that. So without further delay, let me turn it over to Laurie Walters, who is one of the co-chairs of the work group.
Good morning, everyone. Thank you so much for joining us today. We are very excited to have our fireside chat on food insecurity and to provide a little bit more of this information to the community. As Jack mentioned, we are one of the 5 work groups within the North Fulton Improvement Network, and our work group meets on the first Wednesday of the month. We'll keep plugging that throughout the meeting today so that you can make sure to mark your calendar if you're interested in attending. The goal of today's program is really to have a conversation that will provide the current state of food insecurity, not only in Georgia and in Metro Atlanta, but really taking it all the way down to the North Fulton community. We want to see what the focus areas and priorities are for addressing food insecurity, how the North Fulton community can really step up and help to address food access needs, and then to also look at current and future trends and innovations around this space. We are so excited to have a panel of true subject matter experts that are going to be able to share this information with the group today. As I mentioned earlier, or as Jack mentioned when he introduced me, I'm Laurie Walters. I work for Wellstar in the Community Health Department that rolls up to the Center for Health Equity. And it's my pleasure to co-moderate this today with Tanya Morris, who you can also see on the screen. She'll be chiming in and helping with several parts of the presentation. Today, we are also joined by Jon West, and I'm so very excited to have him as one of our speakers. Jon is with the Atlanta Community Food Bank, and he is planning to provide a high-level presentation of what is going on in Georgia and what is going on in all of the communities that they serve. Then we're going to take it down to a little bit more of a localized conversation with 2 of our local leaders with local North Fulton organizations, Doris Pereira and Fortin. We'll wrap it up with a question and answer session. As Jack mentioned, please feel free throughout the presentation to include your questions in the chat box, and we will address those at the end. And now I would like to introduce our first guest speaker, Jon West. Jon is the Vice President of Partner Relations at the Atlanta Community Food Bank. Jon has been at the food bank for 11 years, and in his current role, he's the Vice President of Partner Relations. He works with a team of passionate people who support a network of over 700 community-based hunger-fighting organizations across 29 counties. These amazing organizations are truly the backbone of the region's emergency food network, providing over 75 million meals to more than 700,000 of our neighbors last year alone. Prior to joining the food bank, Jon worked in agriculture relief and development, higher education, and youth mentoring. We are so honored to have him join us today and to provide his level of expertise around this subject. As I mentioned earlier, Jon's going to be joined by 2 additional speakers, and Tanya is now going to introduce our second and third speakers for this presentation.
Good morning, everybody. So we're excited to have representatives of 2 local organizations today. First is Doris, and Doris works with the Community Assistance Center. She has been a program director there for 11 years. And when she presents a little later, she's going to give you a little snippet of, she'll tell you about her organization and also some information about, like we talked about, the local level of things. And then we are also joined by Mel, and Mel is the director of food pantry services at the North Fulton Community Charities. She started there 12 years ago as a volunteer, like a lot of us started as volunteers, and 8 years ago became the first ever director of pantry services when they moved that from a part-time to a full-time position because of how important the food pantry and food programming is to our area. Thank you.
So at this time, we're going to turn the presentation over to Jon. Jon, you've got capability to share your screen, and we're looking forward to seeing your presentation. Thank you for your time today.
Great. Thanks, Lori and Tanya. Appreciate that. Delighted to be here with everyone. You know, one of the things that we are all navigating at the moment, and I think it's particularly kind of a pain point in the work that we're all involved in, is that it's really easy to feel disconnected, right? It's really easy to feel like we are the only folks kind of swimming in the water that we're swimming in, or trying to navigate the challenges that we're navigating. And so even virtual opportunities to connect like this with a group of people who share a common care for their neighbors, for their communities, is really exciting to me. So I'm delighted to be here and really thank you all for the invitation to spend some time talking together. And hopefully this will be some conversation and it won't just be me talking at folks. I'm going to try to get through my piece of this rather quickly and have some chance for dialogue today. But I do want to just thank Jack and Lori and Tanya for the invitation and just also the work that they're doing. I know in our own work at the food bank, we're convinced that the path ahead on our particular issue, and I think similar to other issues that intersect with ways that we care for our neighbors, they have to be done collaboratively and they have to be done in relationship with each other. And so I know Jack and the team here in the North Fulton group have been leaders in that space and ahead of the curve a little bit in trying to organize and gather. And I know there's some other folks on this call. I'm just looking at pictures. I see Barbara and Tamara who have also been longtime champions for that way of working. And so that's been inspiring to me and a big influence on me. So I'm happy to be here with a group of folks who are rolling up their sleeves and have been doing this work for a while together. So thanks for the invitation. Like Lori said, I'm going to give a little sort of a high level viewpoint on kind of what food insecurity looks like right now and try to move through that fairly quickly with an overview of kind of what's playing out across our nation, what's playing out across our state, and then our region. And some of that's just for context. I do think it's helpful for us to be remembering in this work that this is, in fact, what we're all, this issue in particular and the ways that we're trying to solve for right now, this is a national trend. This isn't a blip on the radar for Fulton County or North Fulton, but this is something that is really shaping our nation right now. And I think that's good for us to remember, because there's some things that we can learn from that and some things that we might want to consider in how we solve for some of these issues. And then hopefully we'll move really quickly into a couple thoughts about the road ahead, and then lots of time for hopefully Doris and Mel to talk in more detail about what's happening on the ground in particular in the North Fulton community, and then some time for conversation. So I'm going to try to move through my part of this fairly quickly. And I think Lori and Tanya, what we're doing is kind of holding questions for the end, but I think maybe folks are welcome to put stuff in the chat box, and we'll kind of navigate that towards the end of the conversation. So be thinking and asking questions there, either in the chat or ready to ask them there at the end. I'm going to try to see if I can get this shared very quickly and see if we can make this little guy work. Okay, there we go. And full screen. Are folks seeing that? Excellent. All right. So real quickly, so again, the topic today is food insecurity, and we're going to try to talk as much as we can about some of the realities on the ground. But for those of you who may be new to the issue, food insecurity is really just a fancy way of saying that at some point during the year, a family or an individual doesn't know where their next meal is going to come from. And if you sort of drill into that a little bit on the more kind of analytical side of things, it's really a way to measure at a household level. Does a household have access to the resources that they need to provide the nutrition that the members of the household need to live an active, healthy lifestyle? And food insecurity, as we'll see, is both present and prevalent across our nation and across our state. And there are some particular ways that that's been really highlighted as a result of the COVID world that we are navigating right now. It's impossible to avoid conversations of COVID, so we're gonna sprinkle that in here a lot, because in particular on this issue, as I imagine many of you are experiencing locally, when it comes to food insecurity, there have been some particular pronounced effects on that effort. So I'm going to cover a couple things real quick just to kind of set the stage about who we are and the work we do. So as Jack mentioned, as Lori mentioned, the food bank, we work in 29 counties. We cover most of this kind of northwestern corner of the state. And we're really tasked with making sure that every county in our service area has a group of partner organizations that is working alongside each other to make sure that they have the food that they need to provide to their neighbors. We do that through a broad network of partners, several who are on the call today. I'm delighted, and we'll be hearing from in a few minutes. But they're really the frontline organizations who are working to navigate that space. And what we're really focused on is making sure that they have the resources that they need to do their programming and services on a day-to-day basis. So I'm going to skip past that. If you want more information on the food bank, you can go to our website. Don't tell my marketing folks we said that, but we're going to skip past the food bank ins and outs and move more quickly to some of the other conversation. So COVID-19, we can't race past this just yet, because I do want to put a pin on this on the front end, because we're going to talk a little bit about pre-COVID and post-COVID, but COVID really has shaped everything that we're dealing with right now, and you all are experiencing this in your day-to-day life as well as your organizational life. And this image on the screen is an image from down at the Atlanta Motor Speedway for a food distribution, one of a number of food distributions that we did there, kind of in the, I guess it would have been summer. Time is funny now, right? But I think it would have been late summer. But to me, it really does sort of illustrate a particular dynamic that COVID has had on food insecurity in particular, which is taken an existing issue, an existing problem, and it's really turned up the dial on it in some very pronounced ways. So communities that were already wrestling with this issue have now found it to be an even deeper entrenched issue. And then communities who were really kind of maybe blind to the issue have now had it be very pronounced and present for them. And so those two dynamics of folks of areas and geographies and individuals who are already wrestling with it being even deeper, and then new areas emerging in terms of need has been one factor of COVID-19 when intersecting with food insecurity that I think we'll probably hear some stories about here in a minute as well. The other dynamic at play here, like all of our lives and work, right? The ways that we have traditionally tried to solve for food insecurity and getting food into people's hands and homes have been severely impacted by the COVID-19 pandemic, right? One of the things at the food bank that we are particularly interested in is not just connecting people to food, but connecting people to people. All real change, all substantive change happens in the context of relationships. And so how do we use food to bring people into relationships with others that help them solve for a number of issues that they might be wrestling with? COVID-19, as we are all aware, has made that particularly difficult. So I want to put a pin in that, and we'll maybe circle back on that at the end in terms of some conversation around how we're dealing with this on the local level as well. So we're going to talk some about COVID-19 and its impacts throughout the conversation as well. But just to set the stage real fast, just kind of food insecurity 101. This won't be news to the folks on this call, I don't think. But I think I'd be remiss if we didn't mention this at least on the front end here. Food insecurity, like many of the issues that I know this group has conversations about, is impacted by a number of other intersecting socioeconomic issues as well, right? So when we think about who in our communities might be vulnerable to food insecurity, we need to be mindful of other dynamics that are taking place there as well, right? So minorities in our communities are in a pronounced way more vulnerable to food insecurity than non-minorities. Children are particularly vulnerable to food insecurity. Someone with a disability is particularly vulnerable. Someone who's unemployed, who's lost income, who has less tangible, fungible assets at hand, who has high living costs. All those individuals are much more pronounced to be vulnerable for food insecurity. And sort of if you scan across this page here, right, particularly that bottom line there, and you think about unemployment, you think about income shocks, you think about a reduction in assets, and you think about increases in living costs, that could be one way you might describe the last 10 months of our sort of shared experience as a nation, right? And so then it's no wonder that we're seeing the increases in food insecurity that we are seeing. So economic and social drivers are really important when we start thinking about what food insecurity looks like, who might be vulnerable for it, and how we might begin to solve for it in long-term ways. I'm going to put a pin in this too, in terms of who is particularly vulnerable to food insecurity in our communities. So data and research tells us that people of color are much more likely to face hunger. And this is not just in North Fulton or Fulton County, this is nationwide. And I think it's important again for us to contemplate this as we begin to think about who we're serving, how we're serving them, and what solutions we need to be mindful of moving forward, right? So for example, black households are 2.4 times more likely to be food insecure than white households. Latino households are 2.2 times more likely. Start to think about, as we start to think about who's in our community, who are we able to serve now, who's missing, who aren't we seeing that we might know needs services, that we might know needs assistance. We need to be thinking about the reality of what data and information tells us about who is hungry, and how do we match that up in terms of the services and ways that we're working in our community. So another key point there, I think, is we just sort of begin to understand the landscape of what food insecurity looks like. And this is a national issue. This isn't just a Georgia issue. This is not just a Metro Atlanta issue. Before the pandemic, 1 in 9 people in the US, it's about 35 million people, were food insecure annually. After the pandemic, kind of COVID impact, the sort of dual drivers of high unemployment and a rapid rise in poverty as a result of it, we're now dealing with a situation where we're projecting that about 1 in 6 people across our nation are going to be food insecure in this year. That's 50 million people. 1 in 4 kids in our nation, 25% of them, right? So if you go down a row, 1, 2, 3, 4, 1, 2, 3, 4, every 4th kid in our nation is at risk of being food insecure as a result of the impact of COVID right now. So let's drill down a little bit more and see what that does look like locally. And we're seeing very similar dynamics to what that national picture looks like and what the impact of COVID looks like on our state as well. So kind of pre-COVID, food insecurity was affecting about 13% of our population in the state. Post-COVID, we're up around 16%, so over 25% increase in food insecurity here in Georgia as a result. Here in our service area, across that 29 counties that we are serving, the bulk of the population of the state lives there. So we have a high number of food insecure individuals across that 29 counties, almost 14% of the population. So we're getting close to 900,000 people across that 29 counties, again, who at some point in this year won't know where their next meal is coming from. So a significant increase, again, because of COVID. But I don't want to sort of beat the COVID drum so much that we ignore the fact that even pre-COVID, right? If we're having 11% of the folks who are our neighbors wrestling with this issue, again, we don't have an issue that's just present. We've got an issue that's prevalent. And so the factors that led to that situation were already present and again have been exacerbated because of COVID. So just to look a little bit more granular here, we're kind of before we get down to a look at Fulton County and North Fulton in particular. Again, this is sort of a county view across our service area. So you can see here the 29 counties that we serve. On the left side of the page, you can see what rates in those counties looked like kind of pre-COVID. On the right side of the page, you can see what those rates look like now and are projected to look like post-COVID, and across the board increases. So whenever you're looking at a map and you're looking for your county, the darker the color, the more severe the issue is, right? And so you can see that dark orange pop out on the right side of the map, where we've got counties now who are approaching almost 20% of the folks living there who are at risk of being hungry. Let's look a little bit more deeply at some of those numbers, and in particular, the impact upon kids. Kids, as I mentioned up at the top, are particularly vulnerable. Households with children are particularly vulnerable to food insecurity because of the increased costs associated with child rearing. And here in the state, kind of pre-COVID, we were already pushing food insecurity rates around 15 to 16%. But what we're seeing now post-COVID is that we've got 23% of our kids are at risk of being food insecure across Georgia. And in our service area, 20% of the children in our service area at risk of hunger. So again, 1 in 5 kids, a dramatic increase there, almost a 50% increase in the number of kids who are at risk of food insecurity as a result of COVID. So that's the current situation, right, that we're wrestling with right now. And again, a similar view of a county by county level. And again, you can see across the service area, this is not concentrated in any one county. It's not concentrated in any one geography. You're seeing rural counties impacted just as deeply as you are sort of metro urban counties. So again, the impact, the factors that are involved there and driving that food insecurity are equally spread across a wide variety of socioeconomic regions right now. North Fulton in particular, and this map is a map that I pulled out from some data that we have, and I'll share this with Jack and the team, a link to this map after today's session, and you can click around on it and zoom in and out and get a little more detail and play with it. But this map helps us map food insecurity at a census tract level, and we produce this map annually in collaboration with our national network of food banks, Feeding America, and the U.S. Department of Agriculture. And so I pulled this map out just to give you a snapshot of what food insecurity looks like in the North Fulton area. And my guess is, again, from being parts of some conversations here previously, is that as you sort of see those darker orange areas, my guess is they are concentrated in the areas that you would expect them to be, that there are similar intersecting issues that are concentrated also. But I think what I'd hold up here is, though, while there are certainly some dynamics that are unique to the North Fulton community, North Fulton is not isolated from the larger trends that we're seeing regionally at a state level and then nationally, right? So again, significant increases in food insecurity in vulnerable communities already. So folks that were suspect to it already being more pronounced now. But again, a widespread prevalence across a geography right now where we've got someone who's touched by this issue almost across all of our neighborhoods and our communities. The thing I'd hold up here too that I think we should wrestle with is, again, I'll highlight kids here, and these numbers are for Fulton County as a whole, but in Fulton County, we saw a 50% increase in childhood food insecurity as a result of COVID, right? So almost overnight, 50% more kids were vulnerable, living in homes that were vulnerable to not having enough food on the table to provide for them. So what does that do? How does that shape our thinking in terms of how we care about our communities moving forward? So I do want to just highlight, I'm going to bring this back up again, right? So the equity issue, the racial disparities on this particular issue are really pronounced. And so I think we need to find ways to acknowledge that and to think about that when it comes to our programming, when it comes to our service delivery, when it comes to our funding. So just highlighting this for just a second. So racial disparities in Fulton County, and this is the county at large, but we live in Fulton County. I'm a resident of Fulton County. So we live in a county where 15% of people are living below the poverty line right now. But when you slice that up and you look at rates of poverty for people of color versus white residents. So 23% of people of color are living below the poverty line in Fulton County compared to only 6% of white residents. And so again, that plays out in these very tangible, concrete issues of who has food to eat and how do we get resources to families and individuals who are wrestling with it, and how do we consider and contemplate that dynamic in our work. And it's particularly important for food insecurity work, I believe. So a couple of things then that are that we're wrestling with. So those of us who are doing this work and trying to respond to this work, and several folks on the call can speak up and I think attest to some of these factors as we get towards the back end of the conversation. So as I've already mentioned, soaring need for food assistance. So almost overnight, communities who, as we've discussed, saw a 50% increase in the number of people who are needing assistance. We did some early surveying of our partner organizations back in May, I believe it was, and what they reported to us was that depending on the partner, between 40 and 50% of the individuals that were showing up looking for assistance had never needed it before. So these were newly vulnerable populations, individuals and households who had lost employment, sometimes almost overnight, and were facing a lot of uncertainty about where resources were going to be coming for the future. So almost night with the flip of a switch, some soaring need that we were seeing as we tried to respond to this issue. And so alongside that, that monumental demand, we're also wrestling with a supply gap. And if you can reflect back, and these dynamics have shifted and changed and are no longer quite as pronounced as they were, but you can remember empty shelves in your grocery store, right? And there's probably still items maybe that you would like to be getting or ordering online or in person, however you're doing that, which are a challenge for you to get. So the way we work and the way our partner organizations work is that we're part of that same whole big food supply system. The challenge with us is that we're often lower down on the priority list for distributors and wholesalers. So just at the moment that demand was going up in our community, some of the supply organizations, the ways that we get food were really contracting. And that is still a dynamic in our work right now. And though it has gotten better, but it's going to continue to be something that we have to contemplate. How are we going to get enough food to meet the demand that's in our communities moving forward? And then major disruptions to distribution and operating models, right? So again, this has impacted all of us. And so we're, this is speaking to the preaching to the choir here a little bit. But a lot of our partners, and particularly those that are on the call today, I think have been rightfully proud of the way that they serve folks. So thinking through, how do we provide food that maximizes relationships and maximizes dignity? So it's a high touch model, right? So we're suddenly living in a low touch world. And so how do we pivot, again, almost overnight, to change and adjust our distribution models that accommodate the reality of a socially distanced world? And so that's been happening across our nation, across our 29 counties that we work with, and that is not easily done. And so what that often does is it restricts, again, puts a restricting element on the number of people that we might be able to serve efficiently and effectively at the same time that demand is increasing. So a number of challenges that certainly we've had to navigate, but even more so, I think, partner and community organizations who are face-to-face with their neighbors on a daily basis and trying to figure out how to help them. But having said all that, the community response across our service area and the work that we've been able to do in partnership has really been tremendous. So since April through December, the food bank has been able to provide and work with our partners to provide to our community over 85 million pounds of food. That's in is that 9 or 10 months? I forget. In that period of time, we had already distributed more food than we had the previous 12 months combined as well. So again, skyrocketing demand, but working with our partners, adjusting the ways that we are able to distribute food, we've been able to almost, again, overnight, increase the support and the supply of food out to our communities by about 45%. And we'll talk a little bit more around where we see that trend coming, but it won't surprise anyone on this call, I think, to hear us say that what the new normal looks like is much closer to our current way of operating than it looks like our way of operating 10 months ago. So just in summary, again, I mentioned from April to December alone, and here's a quick translation of pounds to meals. We've been able to provide almost 71 million meals to communities across our service area. Our partners are reporting about a 45% average increase in the number of people that they're serving on a day-to-day, week-to-week, month-to-month basis. So demand continues to stay really, really high. And a lot of folks, again, who are newly in need are continuing to be part of those service models. One of the things that we've tried to do as a food bank is to find ways to connect our partners and communities with resources that aren't just food. Again, that pivot to new models that had to happen very quickly, that didn't come with a blank check attached to it. And so we've been able to provide over $1 million in grants out to our partners and communities to help them navigate those changes, to get the things that they needed to adopt new operating models, to go out and purchase PPE, to find a way to get that new forklift to move more food than they would normally have had to do. And that's going to continue to be a way that we think about operating. Again, how do we not just connect a food resource, but what are the other resources that our partner organizations need to meet the demand in their community? So challenges and opportunities in the year ahead as I close here. One, I've already mentioned it. We've got 860,000 people right now that we think are in need. That's not going to go down overnight. We don't see that really reducing significantly in the year ahead. The last time we had an economic impact like this, if you sort of think back, what's it been, 8, 9, 10 years ago to the Great Recession. It took us about 8 years to dig out of that, what food insecurity levels were before the Great Recession. We didn't get back to that level for about 8 years. Now, hopefully the economic impact of what we're navigating now is going to be much more shortened. But I think optimistically, we're going to have to contemplate at least a couple of years of pronounced and prolonged impact to our communities, where we're going to continue to see elevated numbers of people in need. And so thinking through, how do we respond to that? We've got to be thinking about the disproportionate impact that need is having on minority communities, and how we solve for that, and how we think about different solutions that might be needed there. And driving that, we've got to keep thinking about more food to more people, right? So that graph that showed our distribution month to month, we need that graph to keep going up. And that means that we're going to have to continue to find new ways to source food. We're going to have to continue to find new ways to get resources to our partners. Mel and Doris, I don't know if you'll speak to this, but my guess is that you and your teams are tired, right? We have been running a 10-month marathon. Marathons are not supposed to go over 10 months. They have a defined beginning and end for a reason. So one of the things that we're thinking about, one of the things I know that you all as organizations are thinking about, is as we try to respond to that demand, and how do we sustain ourselves as well. So thinking through, what does it mean for us to get more food to more people more often, and then contemplating continued ways that we know we're going to have to work differently, right? Our normal ways of operating have been disrupted. A portion of our partner organizations remain closed to this day because of worries or fears about COVID, or because of impacts to their staff or their volunteers primarily. We'll see if those folks come back. They may come back and they may not. And so how do we think about filling that gap where those organizations used to be over the long term? Are there ways that we're now doing things differently that we could adopt as new models to carry us forward into the future, right? So how do we take the good things that we've learned here in the last 10 months and invest in them and make them part of our new normal? I think a great example of this are some of the ways that schools have had to pivot to provide nutrition to their students and their families, right? There are some aspects of that I know schools and school districts don't want to continue and should not have to continue. Buses running multiple routes and dropping off meals in bundles to households and parents is not sustainable. But the idea that students and families might be able to access meals in multiple ways spread across the community with the proper resources could be something that's really exciting. So how do we think together as communities about how to sustain some of those things? And then awareness of other resources. One of the things that's been fascinating and exciting and inspiring to see is all the care for our neighbors and our communities that this crisis has surfaced. It's made visible, that care, in a lot of amazing ways where people have stepped up, whether it's through volunteering in the middle of a pandemic, or giving at a new level, or thinking of a creative solution to solve a problem of how someone gets to food or food gets to a person. So how do we mobilize that and continue that investment from our community to really make progress on this issue, not just to kind of get it back to where it used to be, but really to drive long-term sustained solutions for hunger for our neighbors. And then there are other resources, again, that have been, I think it's been very evident how important they are during this time. And again, how do we connect the dots to making sure that those resources carry forward and we prioritize them as a community? SNAP, or food stamps, is the number one thing on my mind and our mind in this space, right? It is bar none the best hunger fighting and poverty relief program that we have in the US. How do we make sure that every household who's eligible for it knows that they're eligible for it and connects to that resource easily and quickly, so that it prevents that household from falling deeper into a crisis, and then they're showing up at our doors more frequently and needing more assistance? So how do we maximize resources like that? And just finally, I'd say, again, I know this is the heartbeat of this group and the conversations that you're already having, but we've got to keep our neighbors and people at the center of these conversations, our thinking, and our planning. It's easy, in particular for me, to get lost in the data, because man, Food Bank loves us some data and we got plenty of it. But how do we keep circling back to the reality that individuals and our neighbors are facing as they try to navigate these issues, they try to find access to support for these issues, and how do we meet them and match our programs and our services with the reality of what they need. So keeping that conversation going in the midst of all these other things, it's easy sometimes for us to push that aside, but I know that's part of what we're working on and wrestling with at the food bank as well. So keeping our neighbors at the center of what we're doing is particularly important in a time like this as well. So that is a really high level and hopefully not too overly long summary of some of what we're seeing, some of what we're doing, and some of what we're thinking about for the future. And so I'm going to pause and turn it back over to, I'm not quite sure who, and I think they're going to pull in Doris and Mel for some conversation as well.
Thank you so much, Jon. Wow, I learned so much during that presentation, and this is a world that I work in on a daily basis, and the numbers that you shared with the group were startling, to say the least. But I do feel like that you left us feeling hopeful, you left us feeling inspired, and there's ways that each of us can truly serve our communities in this space and be collaborative, as you mentioned. I think that's the biggest part of what we're hoping that we can do. So thank you so much for sharing your expertise, and we will make sure to get those slides out to the people that were not able to attend today, because I really do think they tell the full story of what's going on, not only in our state, but in the North Fulton area as well. So thank you so much for your time today. We'll make sure to get the questions that are addressed directly to you at the end. And now I'm going to turn things over to Tanya, who is going to kind of segue us into the next part of the presentation with Doris and with Mel.
Thank you. Yeah, again, great presentation, great information. Doris, let's start with you. Just so in case some people on the call aren't familiar with CAC, if maybe you could just say a word or two about what CAC does in general to address food insecurity or food programs, and then maybe just kind of go into a little bit like what Jon was sharing about how is COVID affected that? Are you seeing more people, less people, the same people? If you could share a little bit about that.
Thank you, Tanya. Hello, everybody, and thank you, Lori and Tanya, for having me here. Jon, good to see you as always and learn from you. Great presentation. CAC, Community Assistance Center. So for those of you who don't know anything about these organizations, this is an organization that serves the communities of Sandy Springs and Dunwoody. About 150,000 individuals living in these cities. However, these two cities are perceived as wealthy communities, and people get surprised that, well, there are so many that live under the poverty level. So in combined both cities, we have a population about of 13,000 individuals that live under the poverty level, and 20,000 more that live under the 200% of the poverty level. So what it means is that people struggle. This group of people struggle to make ends meet, and yes, they are facing food insecurity. What has happened with these two cities is that many things have been, happening in the last 5 years. One of the issues, the main issues we have faced, is that all middle and low income complexes are being torn down to make way for newly built and higher quality, high-rise homes. Rent increase has been devastating. Many families are housing cost burdened because they are spending 63% or more of their income to pay for housing costs and transportation. There is limited or no public transportation for people needing to travel within the Sandy Springs and Dunwoody areas. So, so you can see how they have to manage their own budgets to be able to survive. 50% of our public school kids qualify for free and reduced lunches in these cities. So as a result of all of this, in the last years, we have seen, people living in these cities trying to find more affordable housing, other places to live, and being able to survive. But it also has impacted the way of living, and so the increase for demand and the demand for assistance has been increased significantly at CAC. And 2020 happened, COVID came and stayed, not gone yet, which is bad. So CAC had to react, obviously, to this situation. We responded immediately to it. However, the demand for services skyrocketed. We started receiving about 400% increase of demand for assistance. People that came, during the crisis in 2009, but no longer needed our services, came back. And people that never visited CAC because they didn't have the need are now coming to ask for assistance. Last year in 2020, we served a population of about 9,000 individuals, a little bit over 9,000 individuals. Of those, 50%, 53% were new to CAC, people that never visited us before. And of those, 31% are children. And you heard Jon talking about how this impacts the children population. And this is the CAC children population. 33% of our clients are African American, and 33% are Latino communities that are struggling with this, not with this situation, but with poverty in our cities. 75% of the CAC clients live on incomes under the poverty level. That means that more than 2,600 families. And 70% of them live with incomes under 20,000 or less per year. So during this pandemic, what we noticed is that was a regular clientele, let's say, but during the pandemic, we experienced a higher affluence of higher incomes. People who never needed services before now are coming, and it's what I call the middle class income level are now knocking at our doors because they lost their jobs, because there are no employment for them, because they need to retrain themselves to be able to apply for the new shift in the employment arena. And these are clients that have no idea on how to navigate the system. They don't know where to look for assistance. They don't know about SNAP. They don't know about other services of resources that are there in the community. So we can see a high need there for us to educate our communities and to let our communities know about all these resources and how to bring those resources together for them to be able to get to a better financial stability. Of those clients that visited us, only 63% came to our food pantry. And that is a number that is shocking to me. We have tried to understand the reasons, and some of the reasons is people don't know about it or don't know about how to use the food pantries. Some pride probably involved in it, people that don't feel comfortable, but many responses saying, well, no, I can survive with what I have. Let's other get these services, people that could be needing that more. So our food pantry last year provided food for 6,500 individuals. And also in the food pantry, 50% of those were new to our food pantry, to our food services. So is this all new population, new people coming to ask for services? In average, in the food pantry, our food pantry, when the pandemic started, we just closed our doors, and our model at that moment was to provide pre-packed bags of food. And we were able to work in that way, but later on, and we had to close due to lack of support, manpower, volunteers were scarce. We were so glad that the food bank supported us, and then the National Guard came to support CAC to be able to provide these services. But we opened our doors, our food pantry doors, only 3 days a week. And also, we were not able at that moment to help people living in the farthest areas of CAC. So at that point, it was, really important, that these pop-up pantries just came to serve those areas that we didn't have a capacity to serve at that point. And people were, lucky to have them. The food bank also working with us significantly to provide, these services. So we opened 3 days a week, but our numbers never dropped. On the contrary, even though we were not serving these farthest areas, our numbers kept, increasing and increasing. An average of 500 families per month came every day, to our doors, asking for assistance. Of those, an average of 200 people over the 65 years old. But the problem with them is that they were confined, in their apartments. They couldn't go out. So our food pantry manager managed to send food to them. So we just deliver food to all these senior facilities, places for all residents. And they were able to receive the food on a weekly basis. In addition, we added capacity to deliver food to disabled clients, people homebound, our homebound population, and they are still receiving food delivered by CAC and CAC volunteers to them. The amount of funds that we received last year was, about over 800,000 pounds of food. 50% of that food is fresh food, which is amazing. We are talking about nutritional levels in the food we provide to our clients. Fruits, vegetables, greens, meats, dairy that we have. And this is with the support with these great partners or organizations that we have. The food bank, the second helpings, congregations, businesses, all these constituents that bring food for us to be able to support our people. However, in the evaluation we have with our clients about the services and the assistance they receive, 40% of our clients reported that they had to cut the size of the meals or skip meals due to lack of money to get them. 30% of them say that they do this on a daily basis. Is a daily, thing that they have to do, even because they have to provide for their kids, or they definitely don't have the food, the money to get additional food. 40% of them reported that transportation makes it difficult for them to get groceries and to get groceries from the CAC. CAC was able to go back to our client choice model in the middle of the pandemic. And this was an amazing, job our food pantry did, because instead of keep giving prepared bags of food, we went back to, make the space available for clients to do their own shopping in it. So we went to an outdoor market, trying to keep all this social distancing, and it was, air, so all the measurements for our clients to be safe, and our volunteers also. Later on with the cold days, we had to do something, the cold days are coming. So we were able to manage and have this waiting room under a shed that we have. So people wouldn't, die freezing, waiting for the food. So we've been able to manage, we have had, the resources, but we need more resources, especially we need volunteers. We need people that are, can help us
Sure.
to move the food. We also need additional food to provide to our clients to be able to respond to this demand that we're having.
Sure. Doris,
and
can
we
I
are
just
trying to
interrupt you
manage-
for 1 second?
Yes.
So sorry. So one of the things that you had talked about that I think is really important, and I want to know if Mel is seeing the same thing at NFCC, was you were saying a 53% increase in new people that you hadn't served before, hadn't served in a long time. Mel, were you seeing the same numbers at NFCC, or is this a Sandy Springs Dunwoody issue, or?
We are seeing quite a bit of new people. We're about 41% of new people. And there's so much that Doris is talking about that I absolutely agree with. And what Jon was showing the stats, that we are seeing more people come back. We are seeing more new people. One of the things that we struggle with is we have a lot of people asking for financial assistance, but only 41% of those people are taking advantage of the food pantry. And that's a challenge. And the biggest challenge, I think, especially in North Fulton, is that they feel that there's a stigma and to have to come. And they also feel like, I don't really need it. I'll get by, as Doris said, and give it to somebody else. And that's one of our biggest struggles is we know there's food insecurity out there, especially with families who are just coming into the situation, but getting them to understand that we are that first line of defense, and that if they come and get food, then that helps in so many other ways of their life. And that is our biggest challenge, I think.
Now, with you all three of you have talked about, I know we have some questions in the chat and we're kind of wrapping up our time, but all three of you have mentioned just the high numbers of kids and families with the school year. I mean, I know it seems a long way away, but if you're a parent, the school year is wrapping up and summer is coming fast. Jon, maybe you could start. Is there things that you all are doing differently or that you all need from the community in order to prepare for the summertime with kids and the food insecurity?
I'll defer to Doris and Mel there, but just as a headline, I'd say, again, summer, we always see a summer spike in need, again, because schools are out. It's a little hard, like everything right now, to discern what that's going to look like this summer because schools are already so disrupted. But what we do know is true, as was the case last summer, a lot of the normal activities and organizations and services that operate during the summer to provide a place where kids can get a meal are going to struggle to open this summer as well. And so again, it's that dual challenge of there's going to be increased demand and challenges with supply. So again, on our side, what we're preparing to do is, can we again increase the amount of food that we're able to get to partners, and then connect the dots at the local community levels to encourage organizations who may be on the call here today who don't normally have that as part of their programming or services to think about, well, could I add a meal service to something we're doing this summer? Could I add food as a component to reach the people that we're already serving? But Doris and Mel may have other suggestions there too.
It always is the regular trend, in terms of food. The middle of the year and the end of the year always increase in demand because kids are at home. Last year was a different situation, and the largest increase we saw was in April, for this demand of food. But then after that, children were homebounded. Also, children were at home and families were struggling with it. So we were lucky to partner with this other organization to provide meals for kids. And we've been providing meals for kids ever since. It hasn't stopped yet. And this organization is willing to keep, supporting us on this end until after the summer. So we know that we will have the resources we need to keep providing food for the children. But the regular trend is what you said, summer always is an increase on the need of meals for children.
One of the things that we do, we are also client choice. Excuse me, I have a bit of an allergy going on. But we use points and we get shop using points. So what we've done is increase the amount of points that our families now get. I've changed my programs that allows me to react to things more quickly. And that's what we've done. And then we'll do that again in the summer with families with children. We will increase those amount of points so that it offers more food for our families. We've been very fortunate that our donations have stayed very, very strong. Our neighbors have been fantastic in helping their neighbors. Our pantry has been open to the public, and we have continued to do client choice the entire time. We are seeing about 700 to 750 families every week. We're open 6 days a week, but we are very fortunate to have great donations. And I've been seeing on the chat box a lot about food recovery, second helpings, and are we getting from restaurants and grocery stores? They are a strong donor for us in North Fulton. I know Sandy CAC and North Fulton Charities both benefit from that, which is very helpful for our families, because that kind of thing, that produce and that fruit is so expensive. And if we can offer it to them, and again, if they can understand to come to the pantries, and I think that's our biggest challenge, is getting people to understand coming to a pantry is a good experience. It is not the experience people think it might be. It is not demeaning. It is helpful in so many ways. If they can save money, they can stay in their house. And I think that is so very important for them to get that understanding.
That we're kind of running out of time here with the call. I don't know if Zoom's going to cut us off, but it sounds like messaging and getting information out to people to reduce the stigma is a big issue and a big need. I hope I'm kind of jumping slides here, but I hope that anybody who's on the call today that has an interest in this discussion will come to the food insecurity meeting. Our next one, we have them every month, as we talked about early, and our next one is on March 3rd. And I think that we can continue on some of the great points and discussions that have been raised during this call. Because there had been some other questions about SNAP and, if that's really working and if people applying are really getting it. So I think a lot of that we can continue talking about at that time. Lori, did you want to wrap up for today?
Thank you all for your time today. We had a huge group that were able to learn so much from all three of our speakers. If you would like to attend the next Fireside Chat, it will be Thursday, March 18th. And the topic for that one is going to be more healthcare related. So it is going to have Dr. Jenny Ward Robinson, CEO and President of the Alliance for Global Health Innovation, as well as some medical industry leaders in North Fulton, someone from Caravita Healthcare and someone from Wellstar North Fulton Hospital. So we hope that you'll be able to join us then. Thank you to all of our speakers, and thank you all for your time this morning. We are looking forward to being collaborative with each of you and working through next steps of how we can truly help the North Fulton community.
Yes.
Thank you.
Thank you so much. And I would just do one more little plug. North Fulton Community Charities and CAC, Community Assistance Center, both have fabulous websites. So if you're looking to volunteer, or I saw in the chat that we had some questions about how can I pick up food, how can I get it to people? Please go directly to their websites. There's links on how to volunteer and start the connection, start the conversation that way. And those organizations will get you to the people like Doris or Mel or the appropriate person so that you guys can figure out how to get your food or the produce that you grow in your gardens that are extra to the pantries for people to give. I know that's my big push right now, fresh produce to the pantry. So please contact with them directly because they're constantly looking for volunteers and links to other organizations. So thank you so much.
Awesome. So you do have this Adopt a Row program?
Sorry, what was that, Gita?
I said, do you all have this Adopt a Row program that's where we can grow a row of vegetables and then donate it?
Mel or Doris, do you want to answer that?
Well, we do with Alpharetta. The city of Alpharetta has an Adopt a Row garden. They're starting it at the Rucker Farm, and there are probably 4 or 5 different other organizations that are doing the same thing for us this year.
Okay, yeah, because we're trying to do it at a personal level where we are able to grow it and donate it. So that's why we were looking for something closer to home. Because of COVID, I'm not stepping out too much. So I'm trying to find some places closer to home. Where
And then if you with us, just email us to cacpantry@ourcac.org.
do you mind sending me just messages?
We'll be happy
I'm
to
trying
send
write it
out
down.
a blast, maybe Jack, if we can
If you
send out
don't
a
mind.
black following this with the links to NFCC and CAC for people that need that information.
Yeah, we will send out the slides, a link to the recording and the contact information for the.
Awesome. Okay. Appreciate it. Thank you.
Thank you.
Thank
Great
you.
questions, everybody. Thank you. All right, I think we have to wrap up for today, but please look for those emails and please feel free to reach out to us and join the food insecurity conversation so that we can try to make even more movements in meeting the needs of our community. Thank you and have a great day.
Thanks.